Hi, this is Lalia, one of the principal dentists here at Lume, and I just wanted to make a quick video to help you with your oral hygiene because it is super important to maintain the health of your teeth and your gums, and also to maintain the longevity of any dental work you may have had. So when it comes to oral hygiene, it's quite simple and you probably know all of the advice. I want you to use an electric toothbrush. I want you to brush twice a day for 2 minutes each. Make sure you time yourself because 2 minutes is actually quite a long time. When you're brushing, I want you to focus in the mirror, angle that electric toothbrush up at 45 degrees along the gum line, doing it thoroughly but gently, and then going onto the biting surfaces and then on the inside surfaces, always angling up towards the gum line. Do exactly the same for the bottoms, but angling it down towards the gum line. Again, making sure that you're gentle but thorough. If you're doing this properly, it should take you 2 minutes anyways. Now, even if your brushing is perfect, you'll never be able to get access to certain areas, like in between your teeth or underneath your gums. That's why dentists always highly recommend flossing. Flossing will be able to get in between your teeth and underneath your gums. And why is that so important? Because the bacteria that causes issues like gum disease, like tooth decay, that bacteria hates oxygen. So it tends to hide in these areas like in between your teeth or underneath your gums. So what I want you to do is to use a special type of floss, a thicker floss. And then instead of just putting it in between your teeth, I also want you to gently drag the floss up underneath your gum and clean the surface of your tooth. And again, I want you to do that in between all of the spaces of your teeth. Initially, it might be a little bit tedious, but with time, these habits become second nature. When you're brushing and flossing properly and gently, you shouldn't see any bleeding or any tenderness. If you're using these techniques, but you're still seeing bleeding, it's a sign that there's inflammation there, and that means there's bacteria there. So if you see bleeding, I want you to floss or brush more in them areas, more in terms of quantity, not in terms of strength. It's really, really important. A lot of people see bleeding and they stop, so the bacteria remains and the inflammation remains. So I want you to do the opposite. So make sure you follow all of these tips to maintain proper oral hygiene. Book in with one of our hygienists and we'll see you soon.